So LAL stands for a light adjustable lens. And this is probably the most specialized type of lens that's been developed in a long time.
The light adjustable lens is the first technology we have where instead of just making a prediction on how the eye is going to heal, we can actually see what the final refraction and how the patient sees after the cataract surgery. And we have the ability to adjust or change the lens power to give that person the most perfect vision that we can.
Unlike other lenses, it can be adjusted after it's placed in the eye. So with all other lenses, they're a fixed optical system, a fixed focus. We have to calculate that lens power ahead of time so that it works as expected in the patient. If the patient has a little bit of a leftover prescription at the end of it, we don't have any way to adjust that lens other than by doing additional surgery such as LASIK or other ways to correct a residual prescription. The LAL, though, can be adjusted just by shining a light in the eye with a special light delivery device after surgery to cause the lens to change shape as it absorbs some of that ultraviolet light exactly to that patient's prescription. So we can correct any residual prescription that's there. And we can also give a patient some blended vision so that they can have a functional range of vision from distance to near by adjusting the lens powers accordingly in each eye. So it's really remarkable. It also allows the patient to collaborate on that whole process. So they are involved in determining what their ultimate vision is, and that gives patients a lot of satisfaction.
Patients who are type A personality, very detail-oriented, and have a perfectionist-type personality can often get the exact results that they want. Also is very good for patients who have done monovision in the past, as well as any patient who really wants the highest quality of night and distance vision that their eyes could possibly achieve.
We are very excited to be able to offer this technology, to be the first ones in the area to provide it. We watched this technology develop over really decades before it was finally introduced to market. And then we watched it carefully for the next few years while it was in the market. We wanted to be sure that this was something that was going to benefit our patients. And when we were convinced of that, we jumped right in, and we're fortunate to be the first in the area to offer that technology to folks. So very proud of that.
Personally, I've had LASIK surgery before, and if I were to have cataract surgery, without a doubt, my choice would be the light adjustable lens.